Today's conversation is probably going to make you a little uncomfortable, and frankly, that's the goal. We're having a conversation about how many women just aren't comfortable talking about anything down there. Ladies, from puberty to menopause and everything that happens in between, there's a whole lot to talk about. And if you're not doing it, I'm guessing you're feeling like a piece of you is broken and that you're alone. Well, you're not broken and you're not alone, and this conversation will make you more comfortable. Please don't be afraid of it. I promise you'll learn a thing or two and you'll feel better about your vagina. I said it, and I hope you get comfortable saying it too. The Nikki Eilber podcast is brought to you by the Empowered Cookie. These cookies are soft-baked, they're moist and they're chewy, and they're packed with gourmet, gluten-free and paleo, low-carb, high-fuel nutrition. Get empowered by making the clean, lean, healthy choice of the delicious Empowered Cookie. Go to empoweredcookie.com and use my code Nikki25 for 25% off your purchase.
Hey baby, it's time for the Nikki Eilber podcast. Come on, pull up a chair. We gonna have some fun.
Hi everybody, and welcome back to the Nikki Eilber podcast. My guest today is Dr. Karen Eilber. Dr. Eilber is one of the very few board-certified female urologists in the Los Angeles area who's fellowship trained in female pelvic medicine and reconstructive surgery. I invited her today because she's on a mission to normalize the sexual health conversation, and I so want to be part of that. So we're going to talk about our pelvic health and our physical, our mental, all of us and all of our discomfort with having the conversation about everything down there. Dr. Eilber, welcome to my podcast.
Thanks so much for having me.
I am so excited to talk to you because you're so smart. You talk about the things, I'm so used to talking to people about everything being a hairdresser, and I have met plenty of people who were like, oh, that's too much, I can't talk about that, or it's ridiculous, right?
Yes, but it's so interesting, and you're right. I love how you put I am a little bit on a mission. I didn't set out on a mission, but the longer that I take care of women and I see how few places we have to go to discuss things without feeling embarrassed or ashamed about them, that's how I really, started speaking out about it. And also being in practice for a long time, I had so many women coming and telling me, and part of my practice is maintaining a woman's sexual health because I'm operating on a woman down there. And so obviously that has to be a part of the conversation down there. And I'm so used to saying that because you're not allowed to say vagina half the time.
You can say vagina as much as you want on this.
All right. So those of you who are listening, you can start counting now how many times you say the B word. And I had so many women, tell me they're not sexually active. And it's sometimes for a very simple reason because it just hurts because they're dry. So you tell them, go get a lube or something and come back and tell me, I either felt worse or it was so embarrassing to have one. So that's when I'm like, you know what? Women are not really getting the treatment or the products they deserve. So along the way, because of that, you're kind of forced into this conversation. And even more so because you come to find out that places like social media, you can't even advertise things that have to do with sexual health, even when they're not what would be considered pornographic, which is very surprising.
Because there's so much pornographic stuff online.
Well, because people get very uncomfortable saying the word vagina. So just last weekend at our annual urologic meeting, we actually presented our research on, vagina is not a bad word. And that's because years ago, I had been a guest on a talk show and I was talking about incontinence and prolapse, which is, loss of bladder control and when your bladder is falling, which is in the vagina, right?
What?
And so, right. So right before we go on air, I'm told, oh, by the way, you can't say the word vagina. And I'm like racking my brain going, how am I going to talk about it if I can't say the word? And then you come to think, well, not being able to say the word has such a bad connotation that it is a bad word when it's the medical term for it. There is no other word for it. It's not a slang term. And B, it also just reinforces the embarrassment and shame that we have about talking about conditions involving the vagina. I'm not going to say down there.
So the question is, when did all of this start that it became so, I mean, is it just because of TV and radio that all of a sudden people were ashamed to talk about it and embarrassed about it because they didn't hear it in the public media? Or like, I would imagine that cave people were not so embarrassed to talk about their penis, their vagina, and what was happening down there. When did it start?
Well, interestingly, so our research actually goes back in history, and the word vagina actually was banned really from use in media and things like that. And, it's for the same reason, we're expected to dress professionally at work, wearing the suits and whatnot. Like, why can't I wear what I want to at work? Like, if I like to look a certain way, it's not my fault you want to look down my dress, So I just think part of it is, and I'm not trying to bash and be sexist, but I just think that the different roles that we have played have propagated that. Even our parents, right? Like, so many times when I'm taking a history from a patient, I'll ask, well, what's your family history? And they'll say, well, my mom had something, but she never talked about it. I just think we never talked about these things because they weren't socially accepted. When you tried to, you were considered, I mean, even now, if a woman says, you talk about vibrators, different things, you kind of look at her like, what's wrong with you? Like, are you a slut? Or, why are you so sexual? It's never, it's so funny in male health, like male sexual health is such a thing. And Viagra is a common word. Everyone knows that. But yet when you talk about women's sexual health, I don't even think people even know what that means.
Well, I grew up in a house where we talked about everything. I had hippie stoner parents. So like my mother talked to me about sex and about when you get older. And, the conversation starts when you're little and you learn your body parts. And then as a female, if you're lucky enough, your mom then tells you about puberty and then you get your period. And then you talk about making sure you don't get pregnant. Then you talk about what happens when you are pregnant, then when you're done being pregnant, and then menopause. Like my mom talked about all of that. And a lot of my girlfriends would come to my mom to talk about the stuff because their moms weren't talking about it. And I don't know if men talk about it. I mean, like I talk about it with my children. All of it, I tell my daughter what's going on with me so that when she's my age, she can understand what to deal with. But I don't understand how it just stops in some families and why people are so uncomfortable with it. So, and not only that, like what are the consequences of being so uncomfortable with it? What does that do to people that you have to help them with?
Well, you just opened Pandora's box, sister. I mean, whether it's sex or any topic, there are just some families where communication is not good. Right. And so if your basic communication isn't established already, how do you talk about these sensitive subjects? And I think the other thing is not everybody, I mean, your mom was really more, I'm sure you've realized, the exception than the rule. And she probably was very ahead of her time in the sense that she was familiar with these things. I mean, a lot of women, I had a post one time on my social media that, did you know you have 3 holes? A lot of women don't realize that they have 3 holes. And these are except for like our health class, and this is what gets me too, except for our health class, like in junior high or whatever year we have it, you don't actually have any meaningful health classes or any education about, your female parts down there. And so what you're relying on is either what your girlfriends tell you or your mother tells you. And that's
or doesn't.
And that's also assuming that they're giving you accurate information. I mean, did you really know how to navigate if you thought you had a sexually transmitted infection? Like, what were really all your options for birth control? Did you have any idea what was going to happen to your body after you had a baby? And did you I was going to use the S word, know what you were going to what was going to happen, when you hit perimenopause and menopause? There really isn't. I mean, now there are more people speaking out, but traditionally there have not been outlets with reliable and accurate information for women.
Do you think that's changing because people like you are becoming female urologists and female gynecologists? I mean, back in the day, I don't think my mother ever had a female gynecologist.
I mean, if she did, that was very unusual. About half of male and female physicians in general, in urology, there's still less than 10% that are women. And although gynecologists can specialize in what I do, that's still also a very small percent of people who do what I do. But I think the conversation is opening. There was the Me Too movement. I think that the pandemic, although there were obviously a lot of downsides, I think there were some upsides. People really took to social media, and you reached people and you were able to speak about things that you couldn't in other outlets, right? Like you can talk about whatever you want to on podcasts, on social media. You may not advertise, but these are conversations you probably would not really see on primetime TV.
Right. And it's funny because, like I said earlier, my job is nothing like yours, but there is that joke about hairdressers, gynecologists, obviously urologists, cab drivers, and bartenders who the people have those conversations with. You know what I mean? They tell us everything. Now, you brought up 3 things that I want to backtrack on. 3 holes. In case any of you are watching and you don't know what they are. And also, you talk about doctors who do what you do, but I kind of brushed over it. You're a female urologist and you specialize in our pelvic health and reconstructive surgery, but give us a breakdown of what a day in the life of your job is. And also tell us what the 3 holes are.
Let's start with the 3 holes. That's easier. Okay. So in the back, right, you have the anus, which is where, poop comes out of course. And then in the middle is the vagina. And technically the urethra, or the hole we urinate from, is a 3rd hole. Although if you kind of look down there in that area and you open up the labia, it almost looks like it's a hole within a hole. So I guess you could argue that you have 2 holes with a subhole, but technically
a subhole. I like a subhole. I don't think I've ever used the word subhole in a sentence. I've used it for the back end hole, right. But I've never said subhole.
That's a new term I'm going to coin. So if anyone wants to borrow it, they can let me know.
Do you know where your subhole is? Right. We can make shirts together. I like that idea.
We just made a new hashtag subhole. And a day in the life, my job is so funny. And I'll step back and just say, like, my oldest son, I remember I picked him up from a play date one time and I didn't really know the mom. And she says, "Oh, so, your son says I'm a vagina doctor." I'm like, "Yeah, I guess so. I mean, technically I'm a urologist, but..." So I'll run you through my typical week so you can see. So like tomorrow I have 2 surgeries. I'll be removing 2 women's uterus that are falling and lifting everything up for them and making sure that, and when we talk about like a falling organ or anything, that's what's considered prolapse, which is a very common result of having babies, which again, many women don't know that. And the first time that they see or feel something like this, they think they've got a tumor or something coming out of their vagina. But that's because we don't talk about these things. And, how do you Google bulge coming out of my vagina? And you get like a bunch of different things, obviously, that come back.
And you find out you're dying.
Right, exactly. You're sure you are.
Yeah.
And then 2 days a week I'm in the office and I see all sorts of conditions coming from, recurrent urinary tract infections to women who have chronic pelvic pain and women who have pain with intercourse. And then Wednesday I'll operate again. Thursday I'm in the office. And then Friday is my admin day where I finally get to take a breath and catch up on things. But
like paperwork?
Paperwork, lots of meetings.
Okay.
But, female pelvic health runs the gamut of, loss of bladder control, your bladder falling, again, pelvic pain, pain with intercourse, recurrent bladder infections, just pain in the urethra or vagina that you don't know is what's happening. So that's kind of my life. Taking care of the vagina all day.
Which is, thank God you do that. So yesterday, one of my very best friends was over and she and my daughter and I were having a conversation about what we were going to talk about today. And this dear friend of mine, I think it was during the pandemic, the beginning of the pandemic, she called me to tell me that something was coming out of her vagina. And I said, "Well, get a mirror and look at it." And she was like, "What?"
Yeah.
And so we had a conversation about it. And, she ran for years. She had 2 babies. I said, "It's either your uterus or your bladder. You need to go see your gynecologist." So my daughter is like, "What?"
Yeah.
and now my daughter, while she was in college, was a physical trainer. And they never taught her about the pelvic floor muscles holding not just your pee and poop in, but your bladder and your uterus and all that. And she did NASM, which is like the best training there is. They never talked about, after you have a baby or after you're 50, you probably shouldn't do weighted squats and all that kind of stuff. Now, does that apply to everybody? Absolutely not. Does it apply to some people? Yes. But here's a woman, my daughter, who was trained as a physical trainer, who could have hurt somebody that way. And even they're not talking, but they're talking about the muscle structure of a body. They're not telling the people who are trying to help people with that what not to do and what happens if you do.
Believe it or not, there are pelvic floor physical therapists who
Right.
specialize in that, and which is nice. But again, how would women know that this even exists? And I do feel bad, like when we have the trainees, that they'll spend time with me, and especially like the young men, because I'm like, yep, I know I'm just ruining the whole, like, mythical stuff about, the vagina down there, but you got to learn what's going on, what's going to happen to you.
Are they uncomfortable?
The males,
Yeah.
they're not so much uncomfortable because they're doctors. I think they probably feel more uncomfortable when the woman is uncomfortable. Because, a lot of the women obviously come to see me because I'm a female. And
Right.
it is difficult for me because I am obligated to take care of her. But of course, if I don't train the next people coming, which aren't always going to be all women, then who's going to, it's like you have to have a pilot and co-pilot, right? Someone's got to teach it. But, women in general, we're so used to it because you have babies and everything else, like you don't really care. But these are young guys, and I think they're only uncomfortable to the point where like they also had no idea that these things could happen.
Until medical school.
Right.
So here's a personal question that you can tell me is none of my business, but studying this, being a doctor, and then having children, did you push or did you C-section?
I had 3 elective C-sections.
Because of what could happen if you pushed?
Because I'm a control freak and I did not want that to happen. I mean, having incontinence and prolapse is extremely unusual if you have completely elective C-sections. But if you have a difficult trial of labor and you still end up having a C-section, you can do just as much damage.
From the pushing before you find out you have to. Yeah.
Yeah.
Yeah. I did that twice in one day.
What do you mean?
I have twins.
Oh, that's right. Well, you did it back to back, yes.
I love that I totally stumped you. That was just genius.
I was like, well, did she have a vaginal delivery, then go back and have her C-section, or what did she do?
18 minutes apart. I did it twice. Okay, so we keep talking about women. Do you not see men?
I see very few men. The only men I see are the ones who have voiding dysfunction. So like incontinence after prostate surgery, or let's say they have really severe, like overactive bladder that's responding to typical things. So those are the only men that I do see, but I just don't have time in my practice because it's really devoted to female pelvic health to do any, and I don't even do general urology for most of my female patients. Like if they're an established patient, they, happen to get a kidney stone or something else like that, I'll take care of it. But I just don't have the capacity to take general urology, whether it's male or female new patients.
That's because you're so good at your job that you're so busy that you don't have time for the little things.
Well,
anybody can take care of that.
Yes, let's say that is the reason, although also it's probably because there are very few female urologists who practice the specialty that I do.
I was going to say because of your fellowship training. And by the way, in case somebody doesn't understand what fellowship training is, let's talk about that too.
That's actually a great point. So an intern is a first-year resident, and residency is when you're officially a doctor and you finish medical school. So technically, an intern is just your first-year resident, and then residency varies depending on your specialty. So like internal medicine is 3 years, urology, where I did at UCLA, is 6 years, and then you do a fellowship after residency. So you are technically a full-fledged doctor by the time you're done with your residency, and if you do fellowship, that's additional training. So whether that is, 1 year, 2 year, 3 years. So like when all was said and done, I did 4 years of medical school, 6 years of residency, and then my fellowship. So yeah, you're like 100 by the time you're done training.
Seriously.
I wouldn't do it any differently. Like I love what I do, but I mean, it's got to be a certain type of person to decide to be, for sure a surgeon. I love what I do because, people are generally healthy, because if you're not healthy, you're not really that worried about like if your bladder's falling out or not. And so what I do is truly a quality of life thing. And so, I like to think I make a lot of people happy. Like I do change a lot of women's lives. I mean, can you imagine? I have women who stop running or even stop having sex because they lose bladder control, and you fix that. And it's like a game changer for them.
Okay, so you do run, right?
Mm-hmm. And
that doesn't worry you about your bladder, or is that just because you run and then you sit on the Emsella chair?
Because I didn't have any vaginal deliveries.
Oh, well, then there's that. Okay. So here's a funny thing. Well, it's funny to me anyway. Because I had twins, I didn't have a tummy tuck or anything, and I'm fine. But, there's a little bit of skin. We had babies, right? So I remember when my older sister, who did not have children, was doing a plank one day, and she was like, what the hell? I didn't even have kids. So that stuff happens because we get older and we lose the elasticity anyway. So does your bladder really not, or does the pelvic floor not suffer as much even through age?
Not as much.
Okay.
So you can, I mean, there are people who just don't have great connective tissue, right? So there are people who are just prone to hernias. Right. And basically, when your bladder is falling, it is a hernia of sorts. And so when women have prolapse when their bladder falls, it's usually in the 5th or 6th decades of life. It's not at the time they have babies. So I like to tell women, it's like an old sports injury, right? Like, because you're young, you kind of get over it, you compensate, and then time, menopause, all that kind of stuff sets in. Right. But unless a woman who's never had a vaginal delivery, let's say she's chronically constipated because she's pushing every day, or let's say she does heavy weightlifting every day, because I've also had women who've never had babies, but they are weightlifters, and so they're putting stress on their pelvic floor all the time.
Olivia was telling me about women who weightlift professionally or whatever, and that when they're pressing really heavy weights, they sometimes just lose control and pee their pants in the middle of like squatting a big...
Yeah, well, because it's not really physiologic to have that much pressure on your pelvis.
Right.
I mean, for anybody.
Yeah.
And so those women can still have their organs fall, but it's usually not to as much of a degree. And of course, if you live to be like 80 or 90, whether you've had babies or not, that can still happen. But for sure, the most common risk factor is number and size of the babies that a woman delivers vaginally. And the pelvic floor, it's always surprising to me too. Like when you operate on it, it's not like there's this thick layer of muscle. You think about your own vagina, like it's not super thick. Right. And I think it's like,
thank God.
Yeah, exactly. It's like,
that's a thick vagina.
Hey, but it's like a piece of silk fabric, right? Like it's really, really strong, but you get one little rent in it and you can easily tear it apart. And so I do kind of use the analogy of childbirth is that kind of first little rent. And then just depending on how much stress, that fabric kind of can fall apart over time.
Okay, so I was going to ask you later if all vaginas respond to all the phases of life in the same way, but they don't.
I mean, part of it is your genetics, right? I mean, you tend to be what your mother is. So for sure, women who have a family history, my mom's bladder fell, my aunt's, I mean, you got a genetic predisposition.
Right.
Whether you've had vaginal delivery, if you take hormone replacement, that probably also helps to keep some of the, elasticity and collagen in vaginal walls. Well, because without estrogen, the tissue's thin, right? And so they just become less elastic and they have, they're just weaker.
Right.
Having said that, estrogen replacement alone does not prevent these things from happening. It's just another factor.
Right.
And then just being upright creatures, we're like gravity takes over, unfortunately, like every body part, kind of like, even if you have size A breasts, you're like, how are my nipples aiming straight down? Like, I don't get it.
It is a weird thing. Okay, so this might be a dumb question, but do men's organs collapse?
No.
They don't.
But they have a different, they don't have, the vagina really is quite fascinating. They don't have this big kind of hole, if you will, where things can fall in. They also don't have vaginal delivery.
So just age never weakens everything in the pelvic floor that holds stuff up?
Well, their scrotum gets saggy, but that's about it.
That happens whether you run or not.
That's about it.
And you hear so many men talk about that. Not the men who were uptight, but the other men who were like, when did that happen?
Right. Like we said, gravity takes over everything.
It does. And my husband and I talk about not the gravity part of it, just about the aging part of it, that like everybody's always trying so hard to anti-age. And the truth is, as he always says, Coco Chanel got old. Like, right. And you can't buy youth. You just can't.
It doesn't mean you can't. Look, it's just like your car. Your car is going to age. But if you take care of it and you have good maintenance, it's going to look better longer. Is it ever going to look brand new? Of course not. But it's going to function and look better if you take care of it.
Right. Okay, so you mentioned your sons. Do you have a daughter?
I have a daughter.
So tell us what you would tell me to tell my daughter, or what give those people who really don't know how to have that conversation what you should say to your daughter about all of these things so that they talk to their girlfriends. It's like your daughter should be teaching her girlfriends what she learned from her mom, as far as I'm concerned. You know what I mean? Like that was my job because my mom taught me everything and I was telling all my girlfriends. I became like Dr. Nikki at 14 because my mom told me stuff, So tell us what the conversation should be like with our daughters so that we're not so freaking uptight.
Well, I think our conversations with our daughters, there should be several at different points in her life.
Yes.
Right. And so we've had the same adorable Girl Scout troop since our daughters were in kindergarten. And so I was given the task of giving the talk about when your period comes and what that means. And, I think, they're all little girls, and I think everyone's kind of worried like that they would be uncomfortable and ask questions, but they were all very open. I think part of it was because they all knew I was a doctor, and they all kind of knew that I was, a vagina doctor per se. And it was so cute because afterwards my daughter says, Mom, I'm so glad you're a vagina doctor. So she's only 11. So that's the only conversation I'm having with her. And then I'm going to put her to sleep and get her HPV shots and put an IUD in and call it a day. She won't even know what happened.
There you go. Oh my God. I remember when I had my children get the HPV shots, and my doctor started talking about it when they were like 3. And I was like, dude, they're not sexually active. I'm not doing that yet. But then they were almost 13. And he said to me, if they say no, I can't do it. So we did it. And I remember, is there 2 of them or 3 of them? I can't remember.
2.
Okay. So, and they hurt. Apparently,
yes,
maybe
all
they don't.
Shots hurt.
Well, I guess so, but I mean, you're talking to a diabetic, so whatever. But but there, certain shots hurt more than others, which we know. And I remember we were driving to the doctor, and my son said, "Remind me again, if I don't have a vagina, because we knew why I'm getting this shot." And I was like, well, because you can carry the virus, and then if you have sex with somebody, you can give it to somebody else. And so you have to, if you have sex with somebody, they could give it to you and you might not know. And then you could give it to somebody else. It's the same way, like you should worry about your sister when she's older. If some guy doesn't know and doesn't have the shot, she could give her, she could get it, and then she could get cancer. And he was like, okay, check. So, I had to have that conversation with him too.
You're much better than me. When my sons asked me why they had to have it done, I just said, because if you give a girl cervical cancer, I'll kill you. And that was kind of the end of the conversation.
I think that's a fair answer. I think sometimes you just got to put your foot down with a kid and make sure that you're the mom who threatens them and lets them know that you can kick their ass if you need to.
So I hate to admit it, but like I've used my doctor thing, maybe not so upfront with my kids. I remember I was driving carpool one time in junior high, and I told all the boys that if they smoke pot, their penis won't work. I don't know how long they believe me, but I thought it was a good try.
I'm a doctor.
Right.
You can check with your parents. I'm sure they're going to tell you the same thing.
I'm looking in the rearview mirror, and you can see all the look on their face. Like, is that true? Like, she's a doctor. Would she lie to us?
Sometimes you got to lie to your kids.
Yeah, I mean,
you're not going to like this ice cream at all. It's terrible.
Right.
You're just not going to like it.
So back to the conversation.
Yes.
So I thought about this a lot because my daughter's starting junior high, which is like, I think, a nightmare for most little girls. But at some point, you have to talk about, I mean, who knows when your kids really become sexually active, but, they need to know what's coming. And I always, with my sons, and whether this is right or wrong, and people can judge me if they want to, I always bought them condoms, put them in the bathrooms, and if you use them, great, but the reality is it's going to happen. And if they actually have to go to the store themselves and buy it, chances are that's not going to happen.
Right.
So, I just see too many preventable things at work, and you have to be realistic, and kids, whether it's because of social media, internet, whatever it is, I mean, they're much more educated, for lack of a better word, on, sex and all these different things. So, the talk for my daughter, probably at the end of junior high, I mean, Lord help me if she's sexually active in junior high, before high school, we'll talk about all that stuff. And then in college, you got to talk about, people do things at parties. Like, did your mom warn you that someone could put something in your drink and you could wake up naked in some guy's room and they're taking pictures of you and it's on social media and it can never, those things are never taken down? Like, we didn't have that problem growing up.
Well, we did. We just didn't know about it as much because people didn't talk about it. But that kind of stuff happened. But I'll tell you, I had that conversation with my son when he was going to college. And I said, here's the thing. I trust you. You're not going to do something crazy to some girl. But if you're at a party and you see some guy taking advantage of a girl, or you see a girl stumbling, it could be your sister. And I want you to I want you to help, but here's the thing. Don't ever help alone. Get another girl to help you help her, because you can't trust what people do and what people say. You could drop a girl off to help her, and she could say you raped her. So I had to give him that conversation.
I think that's really smart advice. And, my older son is already in college, so gave him that talk. My middle son is, he's a senior. And I said the same thing. I said, you need to be careful, because also on the flip side, girls can also take pictures of you
That's
and
right.
say that you did something, so
You sent these to me, or yeah.
you took these and tried to take advantage. I mean, it's really scary. But what I say is, yes, those scenarios occurred when we were growing up. The difference was we didn't have phones when we were growing
Right.
up, that those could be on like Snapchat in like a hot second, or be posted on the internet and never,
Right.
you have no control once that's out.
No, you don't. And I also told my kids that. I'm like, here's the thing. Those pictures, they never go away. So do not take them. If
Yeah.
get a Polaroid.
Right.
Don't, not my business. I don't want to see
They're
them.
like, what's a Polaroid?
Except, no, you know what? Polaroids came back again. So my
I
kids
know.
do know what they are. Okay, so these conversations, having them with their children or not having them with their children, but even, when I'm standing behind the chair and I'm talking to women, and sometimes there's a couple of clients at the same time, and one woman is more open than another woman, and some woman is shocked by the fact that she's talking about her bladder falling out or the sex she had the night before or whatever. So I have found out that so many women just can't talk about anything down there at all. And so what's your advice to these women, not only in their 20s, 30s, 40s, 50s, 60s, married, who are not getting what they need from doctors because they won't tell them what's going on, from their partners because they're too afraid to ask for what they need to help things be better? I mean, it's a big problem that people can't talk about down there. What the hey?
Well, again, I think part of it's a broader picture. There are just some people who are uncomfortable talking about anything, whether it's their, relationship issues, their health, whatever it is. And I always tell my patients, who are like you, I'm like, you're just lucky that you are educated and empowered enough to seek help for these things. I mean, there are just some women who, and more power to them, will not accept the fact that this is aging, this is how it's going to be, and too bad. But yet there are a lot of women that they do accept that, or they don't know any better, and I never see them. Right. So, I mean, the answer to your question is, I don't know how to reach people like that. I mean, there is part of it where you just have to get over it and ask for what you want. But that is also, and it's beyond this discussion, but that's just society. And, we are raised to be the quiet, demure gender, and, always defer to, I mean, but look, even now, like, how are we, and this is not a political conversation, but like Roe v. Wade, like, how is that even possible in the year 2022? Like, there is no medical equivalent in men where
Right.
someone else is making the decision for their body.
No one's forcing Viagra down their throat or a vasectomy.
Oh, well, and right. It's not the Viagra they'd be happy to take, right? The vasectomy,
Right.
like forcing, I mean, but it's really mind boggling. And the fact that that can happen, and that, in general, half the country is male and female, that just means that there are still a lot of women who don't feel empowered or equal, or that they have a voice. And that also goes along with your voice for your own body and your needs. And it's only a problem if it bothers a woman. I mean, there are some
Right.
women, like, so the definition of sexual dysfunction is it has to actually cause you distress. So there are women who are perfectly happy, not having sex for one reason or another. And if they're in a relationship and it's fine and it's not causing any distress, it's not an issue.
Right.
But let's say you had a great sex life and something happened and now you don't, it's causing you bother. Yes, you are definitely the person who you need to see someone for that.
Right. Yeah. Yeah. Back to the Roe versus Wade thing, but not a political situation. I recently read that for women in the states where it's not legal anymore already in 2022, that if you have a period tracker, that they are not private apps. And so if you miss your period and then you Google, where can I get a pregnancy test, or where can I get an abortion, all of that can be used against you in court in those circumstances. And that they are telling those women to delete their period trackers on their phone and use a piece of paper and write that stuff down.
That is crazy. I read there was a post on LinkedIn. It was really moving. It was a man and his wife, they already had 2 children. She was pregnant with her third that they desperately wanted. But, she had her screening done and there was a serious chromosomal abnormality, like one that is fatal at birth. And so the choice was, do you wait and have the baby and it's going to die, unfortunately, or, you have an abortion. And of course, it's neither option is, of course, emotionally better, right, than the other. But, it's kind of like cut your losses. So, she decided to have an abortion. He was talking about like they would have been forced for her to have a full-term pregnancy, which it's like more months of knowing the inevitable is going to happen. And then actually, I think it's even worse to actually see the baby and then the baby passes. That was very moving to me. But yeah, it is. I mean, I don't really know many women who use abortion as a form of birth control. I mean, I'm sure there are some who maybe, are not as careful as they should be. But I mean, I think about like, we all had our screening test for pregnancy. I mean, I had my last baby when I was, 39 and much older than I had my other ones. And I was thinking, I mean, I think it takes a very special person to take care of a child with special needs. And I don't know if I'm that person. And it's kind of like, well, why even do all these screening tests unless they're going to change what you might do?
That's right.
So knock on wood, everything was fine, but it's very interesting to think like, and I read an article recently that, if Roe v. Wade like really does get kind of overturned everywhere, what's the point of having all of these prenatal testing then?
Yeah. Yeah. Because you don't have a choice of what you're going to do with it anyway.
Right.
It's ridiculous.
You just have to sit there the remainder of your pregnancy and like stew over it and wonder what you're going to do.
Okay. So we've talked about, a lot of the stuff we wanted to talk about, but we didn't talk about two of the things that I find very interesting about your practice. Number one, you have your own lube line, and there's a lot of lubes on the market. And I'm in my 50s. I've been married to the same guy for a long time. We use lube sometimes. And so that's a normal thing. And I think a lot of women are embarrassed to say that they use it. Now, besides the embarrassment of like going to buy KY jelly, which is so nasty, or whatever that is, you're in the bedroom, you're having a moment, you squeeze the tube, it sounds like a fart in the middle of all that stuff, and you're just like, oh.
You're like, it's not me.
Yeah, exactly. It wasn't me. But it's like, I mean, if you have a good relationship, it's funny, but there's something gross about it. So I bought yours. And I did mean to bring it downstairs with me, but I forgot to. Do you have one there?
I do, of course.
Oh, good.
I have a ton behind me.
Oh, good. Okay, is that what that is? Okay, so I want to tell you what I think of it, and you can explain all of it. So you get this beautiful, I got the black one. So it's the CBD one that does not have the taste to it. And you can put it on a little bit before so that you just sort of relax your vagina. Not enough for anything to fall out. Right. Just sort of like to get it ready before your husband or boyfriend or lover or girlfriend gets it ready for you. But just while you're thinking about it, you touch yourself, you put it on, it's nice. The thing on the top, which is the male-female sign, that kind of looks like a Chanel thing, but it's just so beautiful. Thanks. And it's so pretty, and it doesn't sound like a toothpaste tube when you squeeze it and there's air coming out of it. And you can use it before, during, and after. It's like, it glamorizes lube.
What makes it sexy?
Yeah, well, shouldn't it be? Why didn't anybody think of that before you?
But it's like, why do we put on lingerie when you think, right? Why don't we just put on a regular t-shirt and underwear? I mean, I'm sure some people do, but when it's like a special occasion, don't you go even shopping for your lingerie? Like when you're going away on a vacation? So it's like everything. It's to kind of bring, yes, it's chic, but it's really, the point is to be sexy and get you in the mood. But, back to your original point, the whole thing with lubrication goes two ways. I think women are embarrassed because they think that maybe their bodies aren't working the way that they should. And again, where do you find information? Like things as benign as taking a lot of antihistamines can dry you up everywhere.
I read that. I heard you say that once and I was like, wait, what?
Being on birth control too long, especially like a low dose birth control because the estrogen level is so low. Treatments for breast cancer. We have so many women who have premenopausal breast cancer and the treatments put them in menopause overnight. I mean, imagine being 30 or 35 and you're dry as a bone there, feels like sandpaper. And these are words that are from my patients themselves. If it hurts, there's like no motivation to do it again. And if you're already mentally not prepared, you're never going to have any of your own lubrication again.
That's right.
But there's so many things that can affect lubrication. But the other thing is, I think that the partner, you feel like you insult them because you're not lubricating. And just because you're turned on does not mean your body responds the way that it's supposed to. So again, a little bit of education, right? Because like if, I think generally men, but of course it could be a female partner, right? Oh, I made you so wet. Well, if you're not getting wet, then they think, well, I'm not turning you on. And then it's like, it turns what's supposed to be like this great night into like almost like an argument.
Right.
And so if it was really more common knowledge that so many people, use lube, I mean, there are tons of lubes. Why? Because lots of people use it. And yet nobody talks about it.
Right. I remember when Astroglide came out and it wasn't KY jelly and it was such a cool thing. And I was young and people got it just because it was like, you should try to do it. People who were my friends who talked about it. We got it free. We bought it for each other's birthday presents. We did all that stuff, but so many people don't talk about it. So can you show us the bottle?
So this is the one that you got. Yeah. It's the CBD. And then I don't know if you realize it's actually refillable. So you can take the inner chamber. And of course I picked the one that's probably really tight to pull out because this was just the display one.
Because we're talking about vagina, so you have to say tight.
Right. Don't make me laugh and I can't take it out. So there is refillable. And then you can actually just buy the refills and put it in. But the two things, yes, we want it to be not only like sexy and chic, but like if it's sitting on your nightstand, no one's going to know. A lot of people have, right? A lot of people have children, right. But even, back to what you said, it's different if you're in a stable relationship, you're not embarrassed. But, if you're like, at our age, when you're single, there is definitely a little bit of insecurity that goes on because first of all, you feel like you're competing with 20 and 30-year-olds for the same group of men. Yeah. And also if you pull out something that looks chic and, as opposed to like something that you need medically, it just seems a little bit better. Plus, and it's spray, so you can just use it and toss it off and not worry about it getting like all over the place.
Yeah. What's interesting about what you just said about the being older and the competition, I kind of feel like if I were single, now this is just a guess because I'm not, so I don't really know what I would be like. But if a man came to my house and I had this beautiful thing of lube on my side and I took it out and put it on by myself, I don't think a young girl would have the confidence to do that. And that might be a bigger turn on to an older guy who's just like, this is going to be great. You know what I mean?
Chances are also, unless that older guy has never been married or been with a woman who's gone through hormonal change, like having a baby, most of them know that changes occur.
Oh, okay.
Right. And so they probably would be more offended if a young girl pulled it out because they'd be like, well, why couldn't I turn her on? Right. But it is interesting. And it's cute too. Like I have patients who are like 70 and 80 and we'll talk about like their sexual function. And there are surgeries where the vagina, you can't help but make it a little bit smaller. And I always joke and I'm like, well, it kind of works out well anyway, because as long as you're dating people your age, like the men aren't as hard anyway. So it works out just fine.
There you go. So do you have a bunch of women who are between 60 and 90?
Sure.
And how many of them are sexually active?
So more than not, but keep in mind that being sexually active means different things to different people. So, my sexually active 90-year-old who was with a partner her same age is probably not having deep penetrative intercourse, right? But they're still sexually active. And I always think it's great. I'm like, God, that people have been married for like 50, 60, 70 years and are still sexually active. I mean, that just really makes me happy to see that actually is possible.
Yeah. And also it gives me something to look forward to.
Yeah.
My husband and my husband sometimes he's like, we got to keep doing this because who knows when we're not going to do this anymore.
Right.
Like,
it's true.
Let's do this.
Again, back, like everything we talk about with sex can be put on the broader picture. It's like all the traveling, all the things you want to do. It's like, you got to do them while you're while you're still healthy. I mean, that's unfortunately, we're that age where like shit can happen.
And it does. Okay. And another thing that you're doing that I think is really cool is you're working on finding a way to prescribe vibrators to women. Yeah. Where are you in that?
So we are actually conducting, well, I'll back up even more. There are.
Oh, wait a minute. I'm sorry. I am so sorry that I'm blowing this, but we didn't talk about what your lube is called, where people can get it, or anything. So I want to talk about vibrators in a big way, but I don't want to lose the whole, and you got to use the lube for the vibrator anyway. So let's start there. What is it called?
So the line is called Glissant, Glissant, which means slippery in French. My co-founder and I thought we were pretty nifty getting that name.
I like that.
You can get all the products on our website, which is glissantlove.com. There is another lube that is, and the CBD one is oil-based. So if you're using, condoms and toys on a regular basis, you probably should be using a water-based lube. And that is available at Goop and also at Blue Mercury and also online, of course.
Mm-hmm.
But the water-based, of course, it's a different texture than the oil-based. But again, if you're using condoms and toys on a regular basis, you should be using a water-based one. And if you're also really, really sensitive, you're probably better off using the water-based one as well.
Okay. So now onto the vibrators.
Okay, so
once you're lubed up,
yes. Well, so the whole story of how the vibrator thing came to be was there actually is good data to support the use of vibrators. In fact, in medicine, years and years and years ago, gynecologists used to essentially cause a woman climax in the office to, heal their hysteria sometimes. But of course, if you're doing that all day, like your hand's not really going to work very well. So they started actually they had like tables of vibrator, different things. And then somewhere along the line, vibrators started getting into pornographic movies. And so they kind of fell by the wayside because of the connotation that was associated with them. But there is actually scientific data to show that vibratory medicine is good for pelvic pain, for incontinence, and the studies are few and far between. But the reason why myself and our research group got interested in this is after prostate surgery, it is routine that men take medications like Viagra because it increases blood flow to the penis. So it's not that they're ready to have sex, but we know that blood flow heals everything, right? Brings all the nutrients, everything. And what happens when we get aroused? It's actually increased blood flow to our genitalia. Another thing we don't know or we don't realize is the clitoris isn't just that little knob that you see on the outside. There are little arms that kind of go behind our pelvic bone. So that it's just like a penis. The difference is in a man, the two bodies or crura of the clitoris that are equivalent to the penis are brought together. Ours is separate. And we do have erectile tissue, if you will. And so that's why, sometimes after sex, you feel really full down there if you're really aroused because you have a lot of blood flow down there. So if you're lucky. So if you are postmenopausal and you're not taking any hormones or you've had treatments or you take other medications that impair routine blood flow down there, guess what? Your tissues aren't going to function well over time. So our theory is that regular use of a vibrator, and in our study, whether you climax or not, obviously you climax every time, bonus, but whether you climax or not, the point is to regularly get blood flow to that area to see if indeed it helps with incontinence, pelvic pain, pain with intercourse, all these different conditions. So right now we're recruiting. We will actually stop recruitment in January 2023. But you get a free vibrator if you sign up. It does require 2 visits to our office in Los Angeles. But it's so interesting. So also back at our national meeting last week, we got featured. There's a press section, of course, for the meetings. And we have gotten so many emails from women across the nation, which I wish we could enroll them all, but they can't all come to Los Angeles. But I'm a 64-year-old. I'm an 84-year-old. Wow. I mean, and these are women who, you can't get too much into it, obviously, because they're not my patients, but you can just tell that they've wanted help, but didn't even know where to go.
Right. Which is why your job is so beautiful.
But just the fact that there is a research study involving vibrators, to me, that normalizes the conversation a lot, right? Because even if I prescribe to you to go home and stick asparagus up your nose, your husband might think it's weird, but you'd be like, my doctor told me though, right? There's something about your doctor telling you makes it normal, right?
If you smoke pot, you'll never get a boner.
Right, right, exactly. So that's why I really hope, and I'm already, I think, kind of seeing it just all these emails we get from women, that the fact that your doctor is talking about you using it to help you makes it normal. And yes, can you use it for pleasure? Absolutely. But that also makes using something for pleasure also normal.
Right. If you prescribed me a vibrator, could I write that off as a medical expense?
You could write it off as a medical expense, which you probably wouldn't get reimbursed by insurance.
Okay, fine. Okay, so if I were to enroll in your thing, what would that mean?
So you would come to the office, you get a bunch of questionnaires about your baseline sexual function, whether you have any other conditions like pain, different things. You get instructed on how to use the vibrator. I mean, we're not going to actually have to use it in front of us, of course, but we make sure that you know how to work it. We tell you how many times a week and for how many minutes. And then you check in at certain intervals with those same questionnaires. And ideally, at the end of the study period, you see an improvement in whatever domains we're looking at. And so let's say that your issue is chronic pelvic pain. So we hope that your pain questionnaires actually improve over time. And, you forgot to mention, you had some mild incontinence, and lo and behold, that actually went away too.
And is that just because of when you have an orgasm, it strengthens your muscles?
Yeah. So, there are very few things that actually exercise your pelvic floor, right? And so Kegel exercises.
I'm doing Kegels right now.
Right. Of course you are. Or there's some types of Pilates. Right. And also regular sexual activity. But unfortunately, most of us are not really going to the gym, let alone having regular sex. So,
when my friends ask me, and they do, how often do you guys have sex? And I find out how little people have sex. Now, I understand, and I'm not talking about women who had children 6 weeks ago or even 2 years ago. I'm talking about women whose children are either out of the house or in college or in high school, and they're okay with their parents having sex, the door is locked, they don't come in. Like, most people I know don't very often. It's the weirdest thing to me.
So interestingly, there's no normal number of times to have sex. Again, it's what causes a relationship distress. So if, let's say, both partners are super busy, let's say she's peri or postmenopausal, not taking any hormone replacement, so her libido is already down. He's exhausted all the time. Yeah. It's just not going to happen. And that's why, people talk about like vacation sex and different things, right? Because you have to actually have the time to do it. So, I wrote a blog a long time ago, like skiing to me is like sex. Right? Like skiing, it's a big deal because it's a lot of work, a lot of planning, a lot of gear. And usually like if you take a ski vacation, it's because someone is a big skier, right? And they're pushing it, motivating it. So if you don't have someone in your sex relationship who's kind of like the skier, probably not going to happen. I mean, I think it's such a disservice that movies, all these things, it makes you feel like you're supposed to just all of a sudden be in the mood and want to have sex. I'm sorry, when was the last time that happened for you? Like, it's got to be the mood.
It does, but it happens for men, like the old joke about the wind blows and they get a boner. And then for us, it's like, I'm tired from the kids, I just made dinner, I have to wash my hair, which is, but you think about these things, like, why is it so different for men and for women?
I think at different points in their life, it's for a different reason. Right. So I think that when they're younger, of course, all kids, I think even young girls, right, our hormone levels are really high. Everybody's like, a walking horn dog. I mean, that's no question. And then I think that in your 30s, women have babies and, your hormone levels definitely go up and down. You're now usually the primary caregiver. Mm-hmm. You got a lot more on your plate. Yeah. Right. So just like you said, at the end of the day, if I had nothing to worry about, I probably want to have sex all the time, but I have so many other things going on. Then fast forward, yes, your kids are finally out of the house, but now your hormone levels are really declining because you're perimenopausal or menopausal. And if you also don't have the good fortune of having a good relationship, like so many things come into play for women. And so we have to have a good relationship. I mean, we don't have to, but in general, women like to have a healthy relationship. We want to feel relaxed, like if you have the laundry and the grocery shopping and everything else to do versus I'm going to put on my lingerie and be sexy, what are you going to do 9 times out of 10? You're going to go do your laundry. Yeah.
Yeah.
So I think that's really the difference why, and I don't mean to be sexist, and if this, of course, is not a hard and fast rule, but I just think women do so much more that when it's the end of our day, it's 10 or 11 p.m. and I'm just ready to go to bed and start over again. And that's why, when we're on vacation or you really have nothing else to worry about. Like, I don't know about you, but the only time I sleep through the night and I'm dead to the world is on vacation because I got nothing on my mind. Yeah. I just think we have so many things going on and we're always worrying about our kids and everything else that, again, it's like someone's got to be that ski motivator. I am in the moment, TMI, 3 different times in my life, right? Like when I am doing surgery, right? Like
Yes.
I am just in the moment when I'm truly doing yoga because it's really hard. And then not all the time, but it should be like when you're intimate with somebody, right?
Yeah.
You really should be in that moment. Or like when you're with your kids, you really should be in that moment, but you can't help that and you feel guilty because your mind starts to wander. And that's when it's like you gotta just rein yourself back in and say, this is what I'm doing right now.
Yeah. Yeah. And the rest of it will still be there when I'm done.
That's right.
Okay, so this all started with the vibrator talk.
Oh yeah.
Is it being met with resistance?
No.
Oh,
I mean,
good.
well, resistance by who, I guess is the question.
Well, by the medical boards, by
I mean, so this is what I love about working. Like I work at Cedars-Sinai. They're very, they're a Jewish hospital, and the reason why Cedars-Sinai came to be was because Jewish physicians couldn't work other places. So they started the hospital at that point. So they're very open to everyone. And, obviously we're close to West Hollywood. We're used to like transgenders, homosexuals, like, we deal with all that kind of stuff. So to do research, your studies have to be approved by an institution's, like what they call an institutional review board.
Mhm.
And so they approved the study. And it was really, and actually it's really funny. It was me. I know I kind of joke. I'm like, I think I went through the IRB so quickly because everyone just kind of got uncomfortable at us. They said, just let her do it. It is interesting how well received it's been. And like I said, it's been really amazing to get these emails from women all across the country of all different ages saying, hey, I saw your study, are you still enrolling? I'd like to be in it.
Oh my God, that's so cool.
It is cool.
It's totally cool. And when I came across you on Instagram, I think the first thing I heard you say was, vagina's not a bad word. And I was like, oh, I like her. Let me see more of it. and the vibrator study came up. And what's your handle on Instagram?
Well, I'm Dr. Eilber, and then we have GLISSANT Love for like the product.
It's 30 seconds of really great information that should make you more comfortable. And if you are comfortable, I am begging you to share the channel and also have the conversations that you're comfortable with as many women as you can, because we need this. And the idea that earlier when I asked you if the revolution might be happening because there are more female doctors in your field, I kind of think that's happening. I think that with our older generations who all went to male doctors and they were embarrassed to talk about whatever was happening down there, that it didn't get the love. You know what I mean? Just it's okay to talk about every part of your body. The fact that we are uncomfortable talking about our pelvic health, forget the sex part of it. Our pelvic health, our bladder's falling out and we're not telling anybody? That's absurd. So
it's because you don't want to be that girl who has the broken vagina.
Yeah.
It's like it's back to that, like, we romanticize pregnancy and delivery so much that you think that if your vagina is broken, there must be something seriously wrong with that, because nobody talks about the horrible aftermath when you've had a vaginal delivery. Gee, during the delivery, I shit myself. I now can't control my bladder. Like, I don't even want to have sex because it looks like a train wreck down there. And yet that's the majority of people. But nobody knows that. I can't tell you how many women have cried in my office because I told them, do you know how common this is? Like 111 women will have surgery for prolapse or incontinence in her lifetime. So if you're in a room with 10 other girlfriends, chances are one of you is going to, it's not that you don't all have the issue, but one of you is actually going to have it bad enough you're going to have surgery.
Why didn't she tell me?
Because we don't have these conversations.
We should.
Of course we should. That's why I think it's great that you and, yes, I think it's great that there's more doctors like me who talk about it, but guess what? I don't have a platform like yours. So it's people like you who are inviting people like me to discuss it that's going to make the difference.
Well, maybe you and I should do this more often.
I'd be happy to. And we can talk about the vagina. We can talk about the penis. I got all sorts of info.
I think we should plan on doing it again and talk about all of that stuff. And I enjoyed this so much. And if you learned anything about anything we talked about, you guys, tell your friends. Have them watch this. If they don't like watching podcasts, have them check out Dr. Eilber's Instagram page. Get the lube, because even if you've never used it before, you will find a use for it. And if you want to be in a vibrator study, and I recommend that too, by the way, do it. And if you're thinking it, ladies, say it.
Absolutely.
It's as simple as that.
Yeah. If anything, walk away with, you should not be embarrassed. Like, again, with my patients, like, I want to tell you something, but I'm kind of embarrassed. I'm like, I just looked at your vagina. Like, if you can't tell me, like, I don't know who you can tell.
Or Or while you're there. My hand is in your vagina. What do you have to be embarrassed about? What are you talking about? Oh my God.
Right.
Okay.
The fact that I don't think it's a big deal, like you shouldn't think it's a big deal either.
That's right. That's right. Oh, this, ladies, I hope you enjoyed this as much as I did. And gentlemen, I hope you're watching. And I don't know, is there anything I didn't ask you about that you want to make sure you just throw in there for somebody?
I think we touched on a bunch of stuff, even including Roe v. Wade. So I think it was great.
I think we have completed this part of our podcast together, but you can bet your ass we'll be doing it again. Thank you so much, Dr. Eilber.
My pleasure. Thanks for having me.
Absolutely.